One of the biggest questions if you are moving to New Zealand from the USA will be, what is the healthcare system going to be like? Because let's face it, it is so vastly different to what you are used to in the US.
The huge difference between the two systems is there's no price control in the US. Everything is incredibly expensive.
In this week's show, you're going to meet Adam. Adam moved to New Zealand with his family from the US. He is a type 1 diabetic. He has had plenty of experience with the New Zealand healthcare system. And in this week's show, he's going to show you how the two compare. So let's jump on in and meet Adam.
It's a Drama, coming to you from Taranaki, New Zealand.
Hello.
Daddy, I love him!
Mother thanks you.
Right, Mr. DeMille, I'm ready for my close-up.
Hello and welcome, Adam, to the podcast. So excited to have you with me this morning.
Yes, I'm delighted to talk with you.
If we just smile, we can pretend that we haven't actually just spent the last half an hour dealing with a really annoying echo on our audio. We're going to be very professional and just keep going.
Yes, nobody needs to know about this except us.
They don't. Exactly. It's our little secret. Adam, we have got so much to jump into in this episode. You are going to be talking to us extensively about the healthcare system in New Zealand. So I am going to waste no time. I'm just going to ask you to jump straight in. Tell me who you are, why you're in New Zealand.
My name is Adam, and my family, my wife and my little 3-year-old migrated to New Zealand in July of 2022. We primarily moved here just because the culture in the US, it was just getting to a point where we just didn't want to raise our little girl there. And New Zealand is just a haven for raising little kids, especially. I mean, it's a wonderful place. They can be free. You don't have to worry about any of this safety issues or anything like that we do in the US. And my wife actually works at the hospital, so she's involved in the healthcare system, sort of multiple dimensions. I also have type 1 diabetes. I have since 1986. It's a long-standing chronic illness. And that was one of my greatest concerns moving here was, will I be able to find medicines that I need for my disease? I also wear an insulin pump and a continuous glucose monitor. People that have diabetes will, generally be familiar with that. But basically, it's a bunch of specialized equipment. I was unsure prior to our moving here how I could get it. Would I have to pay for it? Would it be expensive? Will I be able to get all the medications that I'm on? I'm on several different types of medications. And then, of course, more broadly speaking, we didn't really know. The US doesn't have a healthcare system. We have more of a healthcare market. Everything is private, with a few exceptions. Older people have, at 65, you get a certain amount of funded healthcare from the government. Veterans who are injured, they receive a certain amount of care for their related injuries, and prisoners. Those are the only sort of classes of people that have, and people who are really, really poor have some subsidies also.
What about
generally,
kids? Do they get anything?
What about kids?
Yeah.
Oh, no.
Really?
No.
Oh.
No, not at all. There's also a patchwork. Certain city, a bigger city might have a free clinic that you can go to, and I've had to use free clinics to get my insulin at a couple of times in my life, but that's not a universal network. It was just I was lucky enough to live in a big city in Los Angeles that had a free clinic system, and for that period of time where I didn't have health insurance, I was able to get my insulin there. So yeah, so in the US, when you have a chronic disease, there's a certain level of underlying stress that you always have because the health insurance comes from your employer. If you're self-employed or you have lost your job, you lose your health cover, and to pay out of pocket is generally way too expensive for anybody other than super wealthy people to be able to afford. So it puts a lot of people in really tenuous financial situations where they have to ration their insulin, for example. That's a big thing that has gotten a lot of media attention recently and has been behind the push to bring down the cost of insulin. Because a bottle of insulin, which lasts for a couple of weeks, in my case, can cost as much as $300-400 in the US. Whereas in New Zealand, a bottle of the same insulin, the exact same insulin, costs about 50 New Zealand dollars. So even if you don't have health cover, you're still saving a lot of money just buying it cash at the pharmacy,
Mm.
which is, again, the huge difference between the two systems is there's no price control in the US. Everything is incredibly expensive because everything is private and everything is paid for by private health insurance, and people generally pay a small fraction of what the actual cost of the treatment is if they have health coverage.
So can I just jump in before you go any further? I just have to get my brain around this because I know nothing about the US healthcare system. So this is fascinating to me. But I just want to say that one of the reasons I wanted to chat with you on the podcast today is not only are you coming over from the US to New Zealand, but you are type 1 diabetic. And it was always a concern of yours about, getting your medications and things like that, which we're going to talk about in a minute. But also since you've been in New Zealand for the last year and already you've taken your daughter to Medicross and you've been to a trip to a hospital with a head injury. I should have said this at the beginning. You are a wealth of walking healthcare information for New Zealand. So that's why I'm having you on this show.
So yes, let's start from the very beginning. So I think the thing that most people that are coming from the US to New Zealand will want to know is, what do I do? Where do I find a doctor? Everything is focused through the GP, the family doctor. You don't go straight to a specialist like many people can in the US. Everything is focused through your GP. So the first thing you do when you get here is you have to find and enroll in a GP medical clinic that is accepting new patients. Depending on where you are in the country, that can be harder or easier. Taranaki is having a problem with GPs coming here. And so it can be difficult to find a GP that's accepting new patients.
How long did it take you to find one when you got here? How long did it take you?
Well, there was one clinic in Oakura, where you live, that was accepting new patients.
We're never ill here.
And so that's why we live on the other side of town, but we're in Oakura quite a lot because that's where our doctor is.
Yeah.
And they were the only one. And then they stopped accepting patients. We actually enrolled with that particular clinic before we qualified for funded healthcare in New Zealand. And we can get to that later, but because we were worried that they were going to close down and then we wouldn't have anywhere to go. We'd have to drive an hour to the nearest town that would have a clinic that was taking new patients. It's gotten a little better. I checked recently. There's a central website, Health Point, that you can go to, which will show you all the doctors in the area, all the specialists, all the GPs, and then there's a little box you can tick that says, accepting new patients. So you can regularly visit the Health Point website and get a comprehensive list of that.
Yeah, we'll put that in the show notes. But before you arrived in New Zealand, though, Adam, let me just say, you lived in Los Angeles, you said, didn't you?
We arrived from Portland, but we lived in Los Angeles for 18 years before. We lived in Portland for 6 before coming to New Zealand.
And how long have you been diabetic?
Since 1986.
Since 1986. And did you have private healthcare in the US?
Generally, I had health insurance either through my job or through my wife's job.
Right. Okay.
There were periods of time before I met my wife where I didn't have a job and I didn't have health insurance. Those are the times where you really scramble as someone with a chronic condition because you don't know. There's so much uncertainty.
Yes.
And it adds a lot of stress to your life because you don't know, you can't afford $400 for a bottle of insulin. I mean, not just one, but several, because you need several per month.
Yeah.
Forget about the other stuff because any other medications you may be taking are going to be secondary to the insulin because that's critical to survival. And again, it's not only if you don't have a job, but if you have you have your own business, there's no public health care. So you have to pay for your own. And of course, paying for your own insurance is wildly expensive. I mean, the policy that we had with my wife, we could have continued after she left. I mean, we weren't going to because we were coming to New Zealand, but there's a law that says when you leave your job or are fired, you can continue your existing coverage, but you have to pay for it entirely. And it was, I think, about $2,600 a month.
Wow.
Which is, that's a mortgage payment. Of
course it is.
And so you've lost your job, you have no income, and now if you want to keep your health insurance, you have to come up with a mortgage payment every month.
So let me just get this correct then. Before we move on to you coming to the GP in Okura that's got lots of room because I'm never ill. Before we move on to that. So if you live in the States and you've got diabetes that if you're not treated, you will basically die, won't you? If you're poor and you haven't got any money and you need this medication, What happens there? What do you do?
Well, there's a program in the US for the very poor people. If you're really, serious financial problems, if you're a single mom with several kids and you're earning a minimum wage income, like really poverty line, there are social insurance programs that you can sign up for.
Okay.
But in general, if you're not impoverished, if you're just don't have a job and don't have a lot of money, I actually reached a point where the unemployment payments that I was getting disqualified me. I was earning too much income from my unemployment payments to be able to qualify for any sort of subsidized care. The whole system, and it's fragmented, it's state by state, and there's no sort of comprehensive system. So that's the state that people with chronic disease find themselves in constantly, because and you're always worried, if I lose my job. So people stay in jobs they hate just because they need the health insurance.
The healthcare, yeah. And again, sorry, just I know I'm holding you back from telling me your story about New Zealand, but because you're part of our membership community, and I used to hear you talk about it a lot. What was it that you were worried about the most about coming to New Zealand with diabetes? What was the one thing that you were really, really worried about?
There's just the uncertainty of not knowing, how am I going to get my insulin? How much is it going to cost? How do I get my insulin pump supplies? Will I be able to continue getting my insulin pump supplies? How will I get my continuous glucose monitor? Will I be able to? How much is it going to cost me? Like, all of these are questions coming to a new country that you have no idea, and it's scary. So I just started making phone calls. I called the diabetes service at the hospital. I spoke with one of the diabetes educator nurses there. I called Diabetes New Zealand and spoke with some, really helpful people. Each person sort of gave me a little segment of the broader picture, but nobody actually gave me the full picture of everything that I would need to do. So that's what I'm hoping to do here, is help people to understand a broader picture of what to do, how it works.
So go back to now. You're going back to your GP. What happens then? Just tell me.
So yes. Yeah, so the first thing that happens is you have to register with a GP. That's the key that unlocks everything. Find a GP, register, or what do they call it? Enroll. You have to enroll with a GP, right? And then when you enroll with a GP, it gives you lower prices. You're not considered a casual patient. So basically, broadly, the way it works, the GP is the only person that you pay money to. Generally, you see your GP. And any subsequent services that the GP refers you out to, whether it's lab work, blood work, they send you off to a specialist, they send you to the diabetes service, they send you for diabetic eye exams. All of that is completely free. I pay $58 to my GP every time I see them, basically. That's it. That's the extent of how much it costs. There's going to be people out there who are going to say, oh, but you pay higher taxes. I don't think that that's really a viable argument, because we do pay slightly, the tax bracket is slightly higher. I think it's maybe 35 instead of 33% where we are, but it's one chunk of money that comes out from the paycheck, and that's it. In the US, you have little line items for everything. You have a line item for health insurance premium, a line item for dental, a line item for vision, a line item for unemployment insurance, a line item for Social Security, life insurance. Like, there's all of these deductions that come out. And if you consider that part of the taxes, you're paying way more in all of those little nickel and dime things. When you add that to the tax, the actual tax that's taken out, it's way higher than what we pay in New Zealand. So it's a bit of a false argument there, because everything is covered. There's no extra costs in New Zealand. You pay your taxes from each paycheck, and that's it. I pay $58 to the GP. And then what happens is the GP referred me out to the diabetes service, which is at the hospital. The way that works is the GP, anytime the GP refers you out, they'll refer you out to a specialist or the diabetes service or whatever. And you have to wait, because the diabetes service will say, okay, we received the request from the GP. They can accept or deny you. That's a possibility in this system. Obviously, as a type 1 diabetic, they're not going to deny me. And then they triage you as how urgent is your case. So in my case, I need my diabetes supplies quickly. They knew that they couldn't delay, and they put me on as an urgent patient. And so I got in there, I think, within 2 weeks.
Right. Spoke
with an endocrinologist. The endocrinologist at the diabetes service at the hospital took, I spent an hour and a half with the guy. He took my whole history, and he's the one that had to put in the order for my insulin pump authorization. The GP can't do that. It has to be done by a specialist. So that's what happened. He puts in they call it a special authority. The special authority, it's basically a bunch of little boxes they have to tick that says, are you a type 1 diabetic? Yes. Okay, if so, go on to the next question. What is your control like? He just goes through a bunch of prefab questions like a little flow chart. And as long as you tick all the boxes and get to the bottom, congratulations, you get an insulin pump funded. And what that means in reality, because there's people in the US that are saying, well, how much is it going to cost? What's your copay? Because that's how private insurance works in the US. It's very rarely covered at 100%. In New Zealand, it's covered at 100%. There's no extra copay. Well, I do want to say prescriptions technically cost $5. And my insulin pump supplies are technically a prescription. I have to pick them up at the pharmacy. But there's a lot of pharmacies that waive the $5.
Yeah, I was going to say, go to Chemist Warehouse or Bargain Warehouse, whatever it's called. They don't charge, do they?
Yeah, and count down the pharmacy if they don't charge. Even though a lot of the little community, Maryland's pharmacy doesn't charge a copay with the $5. So, prescriptions are effectively free in New Zealand, including insulin pump supplies.
Before you go, can I ask a question? I'm putting my hand up. Look, I feel like I've got to. Please.
Yes, Liz, in the back.
Anyone else? Right. Yeah. So that hour and a half that you spent with what's the name? Oncologist?
The endocrinologist.
Endocrinologist. That hour and a half cost you nothing, did it?
Nothing.
Right. Nothing. Okay. Wow. That's fantastic. Yeah. Second question, and you might be covering this in a minute, but did you arrive to New Zealand? What visa were you on? And do you need to be on a special visa to be able, in order to get this healthcare, this free GP?
So yes. So the requirement is that you arrive on a visa that's 2 years or longer.
Right.
So our situation, I don't want to bog down the details with this. Our situation was a little bit different because we arrived when the borders were closed, and we did not arrive on a 2-year visa. The border exemption visa was a 1-year visa. So there was a period of time where our long-term visa was being processed that we did not have access to funded healthcare.
Right.
So we've experienced it from both sides now. And we did have to take our little girl to the urgent care clinic before we had funded healthcare because she had a fever. So basically what that's like, we didn't have a GP. There is an urgent care called Medicross.
Is this for your daughter now?
This is for my little girl. Yeah. My three-year-old.
How long had you been in the country when this happened?
Oh, maybe a month or two.
Okay.
It took I think it took 2 to 3 months for them to finally sort out the long-term visa. And once the long-term visa was sorted out, that's when I saw the GP who we had enrolled with previously because we didn't want to lose our spot. I saw the GP, he referred me to the diabetes service. I saw the endocrinologist, like that once we got the funded healthcare, the right visa, which in our case is a 3-year work visa, that unlocked the doors for everything.
Okay.
Prior to getting the visa that qualified us for healthcare, I had to see the doctor and my little girl had to see the urgent care. When I saw the doctor, this was for an immigration visa health exam. I paid the casual patient price because I didn't have funded healthcare yet, and it was $75.
Yeah. That
was for an exam, and they needed some extra details from a doctor. So I paid $75. The subsidized cost is $58 for someone of my age.
Okay.
You would pay several $100s in the US just to see a doctor in clinic if you don't have insurance, really.
How quick did you get the appointment?
Within a couple of days, I think. Sometimes I've had to wait, a week. It kind of depends. They triage based on how urgent you are. For little kids that are sick, they tend to keep spots open and squeeze people in. I think now's probably a good time to say children 13 and under are completely free. Healthcare is completely free for them.
That's so fantastic, isn't it?
Yeah, you never ever have to worry that your child, you were asking before, what about children in the US? Well, you just don't have to worry. It's just one of the many parts of living in New Zealand where you can just kind of close your eyes and just like exhale, it's just another thing we don't have to worry about. There's a slight caveat to this. The urgent care clinics are private. They're I'm not quite sure how they fit into the public system, but you do have to pay a minimal fee of $20 if you take your child in during sort of Monday through Friday until 5 or 6. I think on weekends and after 6, you have to pay. They're free.
Right.
So,
Yeah.
I think the idea is if you can't bring them to the GP, you can bring them to the urgent care clinic, and it's free because you don't have the option of going to the GP. But if you do go during GP hours, it's $20. We did have to take our little girl to the urgent care before we had funded healthcare, and the cost was 130. Again, these are all New Zealand dollar figures. Yeah. The cost was about 130, which we had, by the way, reimbursed with our travel insurance. We still had our travel insurance at the time. But again, 130 New Zealand dollars, which is, I don't know, maybe 80 US dollars. It's nothing compared with what you would pay for an equivalent. And by the way, even the prescription that she was given was free, even though she didn't qualify for funded healthcare. It's just the pharmacy benefit. It's just free for children, whether they qualify for funded healthcare or not.
Let's go back to your diabetes then and finish off there. So you've ticked all the boxes now. And
so yes, so I've got, so the endocrinologist at the diabetes service is the one who authorized my insulin pump supplies. They kick me back to the GP to basically do everything else. So my GP provides prescriptions for insulin, oral medications, basically everything else that doesn't require a special authority. I will say that they do send me back. From this point on, the diabetes service, I could check in with them every few months, every 6 months, and be seen by a diabetes nurse educator. I don't think that they're used to the same. You don't see the endocrinologists. You don't see specialists the way that you would in the US, because they're a really limited resource and they need to be there for the people that need them the most. So, I needed him to establish my diabetes therapy, but now it's pretty much managed by nurses. I just had a phone consultation, my first follow-up phone consultation. It's about 6 months later, sent her my blood sugar reports. We're going to talk about that in the following days. There's an ongoing blood test you need to get done as a diabetic called an A1C. She basically sent me an authorization form that I can bring to any lab, either the lab at the hospital or there's a private lab. It doesn't matter. I just bring the form, and every 3 months I can get this test, again, at no cost.
Right, it's all free.
Yeah, I don't have to go to my GP and pay $58 every time I need an A1C test. I just take it directly to the lab and I can get it done.
So your insulin, is that on like a repeat prescription? Is that
so
right?
Yes. Yeah. So the insulin is on a repeat prescription. So the way it works here, similar to the US, is they fill it in 90-day blocks. Unlike in the US, the pharmacy will just call the doctor and say, hey, can I have a repeat fill for this? It doesn't work that way. You have to call the doctor yourself. And our doctor's office actually charges $15 to do prescription repeats. It's kind of a new thing.
Mine charges $30.
Oh,
so you count yourself lucky there, Adam.
Oh, okay. I didn't know that. They just introduced that in January. So I didn't know how common that is in New Zealand. So every 90 days, I need to call them up, say, hey, I need my repeat prescriptions done. They send me a bill for $15. And, or, I see the doctor. If I need to see the doctor for some other reason, they'll just fill it as part of the $58 I paid as part of the visit. All of that is really easy. I do want to say there is one medication that I take. It's an oral medication. I don't need to get into the detail. Well, I mean, maybe some people who are diabetics might want to know. It's called empagliflozin or Jardiance. Mm-hmm. That particular drug is intended for type 2 diabetics, and I'm a type 1, but it's worked really, really well for me. I've been taking it for over 10 years. That requires a special authority, and I don't meet the special authority criteria because the special authority says you need to be a type 2 diabetic. So immediately I'm disqualified. Now, it doesn't mean I can't buy the medication myself. I can self-fund it and buy it at the pharmacy. It's just not funded by Pharmac, the organization that makes these determinations. If it were funded, I would get it for free or $5. Instead, I have to pay $83 a month for that particular medication. It's very expensive by New Zealand standards, but I just want to tell you that a month's supply of this medication in the US cost about $800.
Wow.
Yeah.
Wow.
Yeah. And I know that because every time you fill a prescription at the pharmacy, you get a little printout that says, this medication cost $2,500. We paid, your insurance paid, $1,980. You owe this much.
Do you think they're just saying that though, Adam, to make it seem like a bargain that you've got the insurance?
It can't be made up because they can't just make up the numbers like it's,
Why is it so much more expensive then? Is the US ripping people off, or is New Zealand just such a bargain? Why is there such a difference in price?
I think the US subsidizes the rest of the world's drug costs in some ways because the drug companies make so much more profit on each, pill that they sell in the US. That's kind of always how it's been. So I don't think New Zealand is doing anything unique or strange. I mean, there's virtually the entire rest of the world negotiates drug prices. It's just the US is a market-driven system, and by and large, the free market has control. I think they just recently authorized in the US drug price negotiations for Medicare, which is 65 and older. That's the federal social insurance system for older people. But that's it. In fact, they were specifically prohibited by law from negotiating drug prices. Even crazier is every individual hospital and healthcare system in the US does their own drug price negotiations. Eva knows this because she's worked in hospitals, pharmacies her whole career. So one hospital could be, with a larger population, might be negotiating a price for a drug that's, less than what a smaller hospital would charge for the exact same drug. It's a wildly disjointed, incomprehensible system. Whereas here, the price is the price, no matter where you go.
So tell me this then, having been in both countries now, you've been here for a year, you lived all your life over there, and you've obviously spent a lot of time in hospitals and in doctors' surgeries and things like that. Is there a difference? Do you just think, oh, it's much better and it's much more flash in the US, they've got much more higher technology things, or do you think they're the same? Or how do you feel about the whole healthcare experience comparing both countries?
So there's a bit, after living here, there's pros and cons to each. In the US, you have access pretty much to almost everything. You'll find that the formulary, which is the national formulary, those are the drugs that are allowed into the country. There's an agency called MedSafe that's kind of like the FDA. They're the ones who determine whether a drug is safe and effective. So the first thing that has to happen is MedSafe has to approve a drug before it can be sold in New Zealand. And then Pharmac is the agency that comes in and negotiates the price if we're going to fund it or if we're not going to fund it. So there are certain drugs, like cancer drugs, from what I understand, that might be MedSafe approved but aren't funded by Pharmac, which means that you could potentially be in a position as a cancer patient where a drug is available but not funded, and the patient would have to come up with a lot of money to figure out how to do it. Now, this is kind of where private health insurance might come into play. I don't think it's super common for people to have private health insurance here, but it is an option. And the private health insurance plans will kick in where the social health insurance doesn't. It's not cheap, but it's very cheap in comparison to what US health insurance policies cost. So for example, I gave you that example earlier, my wife's health insurance would have cost us $2,600 a month. We talked with an agent we were looking at some really rich policies that would end up costing $1,500 to $2,000 per person per year.
Say that again. Year. How much? Say it again.
It depends on the policy, but we were looking at roughly for a very full policy, 1,500 to 2,000 New Zealand dollars for the entire year of cover.
For both of you?
No, per person.
Per person.
It came out to about 6,000, 6,000 if we want the entire family covered.
Right. Okay. That's not as much as I thought it would be, to be honest. I thought it'd be a lot more than that.
Yeah, it's not. And again, coming from a perspective where, 1 month can cost you $2,600, it seems like nothing.
So are you going to go for it or not? Sorry if that's a private question.
It's on our radar.
It's on your radar.
It's
right.
on our radar. Yeah.
Okay.
So I can tell you just recently, I was having this recurrent sinus infection. The doctor got me all fixed up with some antibiotics that worked great, but he wanted to rule out, because it's been recurrent, he wanted to rule out like a sinus disease. So he referred me to the radiology at the hospital for a CT scan of my sinuses. The first thing he asked me was, do you have private health cover? I said, no. Why? And he said, well, you could be seen faster if you have private health cover. I said, how long will it take to be seen at the hospital? And he said, it would be, if you have to wait, it'll be months, not years.
Right.
It ended up taking like 3 to 4 weeks for me to be seen at the hospital. Now, I could have gone to a private radiology clinic in town. They do CT scans on a walk-in basis. You don't even need to make an appointment. If I had private health cover, it would have been covered 100%, funded by the private health. I wouldn't have anything to pay. If I wanted to self-fund, pay out of pocket myself, it would have cost a little over 500 New Zealand dollars. I don't know, honestly, how much CT scans cost in the US. I would venture a guess that it's way more expensive than $500. It wasn't urgent, though. I didn't have a pressing need to pay for it. I waited my 3 or 4 weeks, and I got a call. Okay, you've got an appointment set up. They don't actually call you to make an appointment. They just sort of say, this is your slot, which is a big difference too. I think that's, if you can't make it, I'm sure you can call them and work with them on it. But it is a bit strange for them from an American perspective, where everything is sort of service oriented, that they just say, no, this is when you'll come in for your CT scan.
In America, do they just turn up with like a bunch of flowers and go, hey, good morning?
Oh, no, I don't think it's like that. But I want to make a point here, because there's a lot of people in the US that say, oh, the waiting lists, they talk about people that disparage public healthcare systems. They talk about the waiting lists.
What, in New Zealand are you talking about now?
I'm talking about in the US. There's people
US.
that, people that are concerned about, that's one of the primary criticisms of a social health care system, is that, you have to wait. And there's truth to that. But I think that having private health cover also really mitigates a lot of that concern, because it's not terribly expensive. Like I said, if you have it, things are so much more accessible. I think there was a story you told one time about, you didn't want to wait for a particular procedure, so you just went to the Southern Cross Hospital and just had it done the same day or something. Like it's that doesn't happen, because in the US you can still wait. If you need to see a specialist, you could still wait for 3 months to see that specialist. The idea of being able to walk into a radiology clinic and just get an on-demand CT scan, it's very strange from the US. I can't imagine that ever being the case. So, it's true that there's waiting lists, but you can also wait in the US. So I'm not sure that that's really a really valid criticism. But again, there's good and bad to both systems. But I'd say on the whole, it's way, way better, and it's way fairer and more equitable to have a system where everyone is covered. And then, if you can afford it, I suppose there's that sort of elite system which will allow you faster access. And I can understand why that might ruffle some people's feathers. You're thinking, where people who are paying for this elite care, but the option exists, and it really neutralizes a lot of the criticism, I think.
My father-in-law, he had a gallbladder attack. I don't know if you remember last year, he had a semi-stroke thing, and it turned out that he needed his gallbladder removing. And my mum was up at the hospital, and she was like, well, when can you do it? And they said, well, you'll go in a waiting list, and you'll be in, how urgent it is how quickly you'll be treated. And it's been cancelled twice now. And mum went up and said, look, I just want to pay. I just want to pay private. I'll pay whatever it takes. I just want to get him sorted, because it's a worry for them. And apparently the guy up at the hospital said to her, to be honest, it wouldn't matter if you were private. You would still be waiting, because people on the private list are going to be seen again, as a matter of importance before you, who's more urgent. So yeah, I don't know about the whole private healthcare thing. And Yeah, it's an interesting one, isn't it? And yeah, that story that we told you about going to the clinic for the scan, you know, when they do that scan on your stomach, and I was offered, oh, you can go up to the hospital, you can wait for the hospital one to come across, or you can go private. And I said, oh, I'll go private, and it still took 2 weeks to come through. And I thought, well, you know, it's not like being seen the next day, but yeah, it's not months and months and months, but yeah, just something to note, I think.
Yeah. Yeah, it's. I will say, I mean, if we do want to talk about, you know, the some, I think, legitimate criticisms of the system. There's the system here is that there's definitely an access issue in more rural areas like where we live. Again, it's hard to find GPs. You know, if you're a Maori or indigenous person or you live out in the country, you might not have a pharmacy that's open on the weekends. You might not have a pharmacy at all. So in order to find the drugs that, you know, it's interesting because in the US, we talk about equity of, you know, access. It's based on money. Here, because if you can't afford or don't have health insurance, you can't afford healthcare. That's what our situation is in the US. Here in New Zealand, there's just not a doctor or a pharmacy near enough to you. You have to drive an hour to get to where you need to go. And of course, people that in those situations are more likely to be indigenous people who live out in the country, or, you know, people with less means. So it's harder for them to access where the healthcare is. It's still an equity issue, but it's different. You know, the idea that you can have a free, you know, a public health system and still have access and equity issues was very, very interesting one to learn about when we came here.
I mean, I won't go on about the UK, but just to throw it in here, when we were moving from the UK, everyone was like, oh yeah, but the NHS, you know, you're going to miss out on that. Now, do you know what? I would choose New Zealand over, from my point of view, from England, any day over the service that I've talked about this lots of times, but yes, it was free in the UK, but I'm not joking. You were literally treated like cattle. You were like, you've got one thing you're allowed to say. Don't bother telling me more than one thing. What is it? And this is not a criticism of the GPs, because I know it, you know, they're just doing what they have to do, but it was like so impersonal and so quick. And now, and you think, okay, all right, yes, I'm paying $70 or whatever it is to see them, but I can sit there for 20 minutes, 25 minutes, whatever it is, whatever it takes. And I would much rather have that. So yeah, I just wanted to, I know we're not talking about just give you.
Well, now, I know that at our clinic, and you know, every GP clinic is different. Each one is a private business that runs things themselves. So I don't know, this wouldn't necessarily carry over, but I know at our clinic, you're booking a 15-minute slot, and if you go over, there's a little check mark on the form that the physician can tick that says it's an extra long appointment, and then you get it. There's a surcharge. So I've had them tick the box before where, you know, and then instead of $58, it's about $75, which is what I would have paid for, you know. But yeah, I don't ever feel rushed, and there's been plenty of times I'm sure we've gone over the 15 minutes a little bit, and they don't tick the box to charge us extra. Can
we just talk, Adam? Can we just talk, because I know you're going to be rushing to pick up May in a little while, so I just want to get this. I really want you to tell me this story.
Yes.
Because you've just had a recent hospital experience, haven't you? An ambulance and
I did.
Like tell me all about it.
Very exciting. Okay, well, I was mowing the lawn. This is a couple of months ago. I waited until, you know, the sun had gone. It was, it's the summer here in New Zealand. And it was hot during the day, and I waited until the evening. The sun had gone down, so it was a bit cooler to do the lawn mowing. And so the windows in New Zealand, they're hinged at the top and they push out. That's kind of the way standard windows work here. Different from the US, they kind of slide up and down in the frame. So that means if you're not careful and you're walking around the perimeter of your house, let's say mowing your lawn and looking down at your feet while you're doing it, those open window panes are right at scalp level. And I walked right into one, and I don't know if I don't want to get too graphic here, but scalp lacerations, it's just by their nature, are very, are gushing. It was, so we didn't just want to,
serious.
We didn't just want to go to sleep. I didn't want to go to sleep with a head wound, obviously. So our little girl was asleep. So Eva had to stay at home. I didn't want to wake up our little girl, but I knew I needed to be treated. So we called 111, which is, the equivalent of 911 here. Called for the first thing they say is police, fire, or ambulance. I said ambulance. And I would say within, I don't know, 5 minutes, there was an ambulance and medics who examined my head. They said it's superficial. It's not that bad. You can either go to the hospital yourself or we can take you. And I, knowing that I didn't want to be standing there with a compress on my head and driving the steering wheel because Eva needed to stay home with our little girl, I said, please, can you please take me to the hospital? And they said, okay, no problem. So I had the first ambulance ride I've ever had in my life. They were giving me cold compresses on my head, took me to the hospital. And the only form that they had me fill out was an ACC form. Now, ACC stands for what? Accident Compensation Corporation, I think. It's a national insurance scheme in New Zealand that covers anything that's considered an accident. It helps it eliminates or it subsidizes the cost of anything that's an accident. And that's whether you qualify for healthcare or not. You can be a visitor to New Zealand. If you're in an accident, ACC will kick in. And anything at the hospital is free. The ambulance ride, which ordinarily I think would be about $90, the ambulance ride is free. And by the way, $90 for an ambulance ride by US standards is also nothing. I mean, people could be charged thousands for an ambulance ride. But yeah, the ambulance ride was free because, again, this was an accident. I waited in the ER. Again, this is probably about 8:30 or 9 o'clock at night that I got there. I was out by 10:30. I was seen by a doctor. I was fortunate it wasn't busy. There were a couple of parties ahead of me. But I just waited. I was seen by a doctor. He stitched me up. I got 3 stitches in my scalp. He gave me instructions on how to treat it. He said, see your GP for a follow-up in 7 days. And that was it. And then they called me a taxi to take me home. So
did you have any brain scans or anything like that, or just?
It wasn't anything like that. They said it was very superficial, like the medics on the ambulance said. It looked a lot worse than it was. So, fortunately,
scary though, isn't it? When you see blood coming out of your head, that's really scary.
Yeah, it's terrifying.
Yeah,
but not uncommon. There are some nurses, Katie B said, yeah, that's just what they are. It's not anything that you need to be that concerned about.
Yeah.
So yeah, I got all stitched up and saw the GP. By the way, the nurse called me the next day. The nurse at my GP clinic called me the next day to check up on me and see how everything was going.
Oh, that's nice.
So the hospital communicated with my GP. And then when I saw the GP for the follow-up a week later, with the ACC subsidy, my visit instead of $58, I think was $30.
Right.
And then when I had the stitches removed, about like a week later, that was also by a nurse at the GP, and I think that cost $15.
Right.
So it's pretty. You
minimal. Got away lightly, didn't you?
Yeah.
Did you finish the class or not?
Eventually.
I hope you went back and did it.
I'm extra careful about closing the windows now before I walk. And some of them are at toddler height too, so it's pretty terrifying. The corners on those windows can be really sharp too. So we're a bit paranoid now about making sure if we build our own house in the future, there's going to be a hedge around the perimeter so that any open windows.
Yeah. Yeah, I didn't even think about that actually, but they do. They our windows push out too. So yeah.
But overall, it was an interesting experience. I can't say it was painless, but it was it was a really good education on how the system works here. And I want to repeat, no bills at all from the hospital. Nothing. Nothing. When you're seen at the hospital, it's just part of the health cover.
So Adam, you don't have to answer this if you don't want to, but from what I can tell, you've had lots of experience with the New Zealand health system, and it's been all been positive, hasn't it? You know, your little girl was
generally it's been really positive. The parts that concern me are more there's less focus on preventative screenings, and I think that's probably due to resources. For example, in the US, I think they lowered the colon cancer screening age to 45 now. So in the US, I would be recommended to have all of that stuff. Here in New Zealand, they don't do that. They recommend, if you have a family history of colon cancers, they'll do it early. Or if you've had any, cancers in the past, related cancers in the past, they'll do it. But otherwise, there's no colon cancer screenings until you're, I think, late 60s, which is a bit scary. I had a friend who died at 59 from colon cancer.
Can you pay for it privately? Can you just say, "Oh, I'll just..."
Yes.
Yeah.
So here's how it works. So yes, you can go and pay for it privately. It's not cheap. I mean, we're talking, it'll be a few $1,000s. I think they average at about 3,000 New Zealand dollars. Again, which I'm sure is super cheap compared with the US, but it's expensive. Now you can say, oh, what about private health cover? That's a good question, Adam. I'm glad you asked. So, because I investigated private health cover for this particular thing, it doesn't work that way, because in the US, everything is private health insurance, and you would just see a specialist that's on your insurance network and they would do the thing. Here, you still have to have a referral from your GP, and the GP is not going to refer you if you don't meet that criteria of being, of having, cancer in your family, or right age for it. Yeah. So even with private health cover, the GP is not going to refer you, and therefore the private health cover isn't going to pay for anything. Now, if you pay for it yourself, let's say you do pay the $3,000, you get a colonoscopy and they find something, then everything kicks in. But you have to do the investigative outlay of money yourself. So, and that would be, both the public system and the private system would cover you at that point. But it's not sort of like, it's not a buffet of choices like it is in the US, where everything is covered. Now, again, it's a bit deceptive, because even when you have health insurance in the US from your employer, you're still paying hundreds of dollars, likely a month. And then that's not all you pay. You still might have to pay 10, 20, 30% of the unfunded cost of the procedure. So it's a bit of a shell game. You're still paying money, you're still paying for it, but the charges are sort of hidden and, tucked into your paycheck premiums that have been, deducted and things like that. So I'm not entirely sure it is really what you think it is. Because
you tend to think, oh yeah, if you've got private healthcare, everything will just be covered, wouldn't you? That's it.
And I'd like to touch on this, circling back to my diabetes. I mentioned diabetics that are watching this will know there's a technology called continuous glucose monitors, which is a sensor you wear in your abdomen. You change it out every 10 days. Mine, I change out every 10 days. And it's a critical component to modern diabetes therapy, because it helps to automatically regulate blood sugars without your input. It limits the need for the diabetic to constantly manage their diabetes like you would if you were just taking injections, without this monitor that's monitoring your blood sugar 24 hours a day. So that's not funded yet in New Zealand. And it's going to be funded soon. There was just a release from Pharmac saying that they're sort of in their last stages of getting proposals from the companies that sell that technology here. So things do seem to be going in the right direction. Australia funded it last year. It's been funded in the UK for many years. So New Zealand, as always, is kind of the straggler, but Pharmac has finally, acknowledged it's an essential therapy. but it's not funded yet. And I ran out just a few months ago of the supplies I brought from the US. So I did have to pay, it's about $1,200 for a 90-day supply of these sensors.
Ooh,
yeah, that's the greatest expense. And again, it's because it's not funded here.
Yeah.
If it were funded, I mean, I don't know if Pharmac is going to develop, a special scheme. I think in Australia, Australians still have to pay a certain percentage every month of their sensors. New Zealand's by comparison is very generous, but we don't know until we know. But yeah, that'll be saving us, $400 a month, if potentially when that's finally funded by Pharmac. But in the meantime,
a lot of money, isn't it?
It's a lot, but it's also essential. So,
yes, exactly. Yeah. It's not something you can just think, oh, well, we'll just go without that this month.
Mm-hmm. Yeah.
I was going to say to you, because, again, people's concerns, especially Americans' concerns coming over to New Zealand, they will often say, I need that brand of medicine. Like, that's the one that I've always used. And what if I get to New Zealand and I can't get that brand? Can you just talk about that for a minute?
Well, that's a valid concern. One of the things that you notice when you first come here is that the brands tend to be completely different. The brands of everything. There are no recognizable stores at the mall. I mean, aside from, the odd American fast food place, the stores are all different. The products are generally all different, from the detergent to the breakfast cereals to if you're used to buying your blue jeans from Banana Republic, you have to find a new place to buy your blue jeans because it just doesn't exist here. There's no Apple stores here. There's just not a lot of stuff. There tend to be more Australian brands than North American brands. So you have to get used to that. Now, of course, prescription drugs are kind of a different thing. You are, of course, bound by whatever the formulary is, and not everything is available, but there's generally equivalence. So, if I had an ointment for eczema that's not available here. Over-the-counter drugs is kind of a whole other issue, because we have run into issues where, we've had this cough and this sinus infection, and they sell dry cough medications. It's basically all falcodine, which isn't a drug that's used in the US really for anything, and it's not particularly effective. And Fall, in case anyone wants to look it up, it's PHOLCOD, what is it? EINE, falcodine. I think I might have switched to E and the I. But the drug generally that you would get in the US is dextromethorphan. And I went to many, many different pharmacies. I was told by pharmacists, it doesn't exist in New Zealand. I found it at Bargain Chemist. They had a bottle behind the pharmacy counter, and it's worked great. Not a brand, just one, but I know I should stock up on it. I should stock up on it. So it's a bit, sometimes it can be a bit tricky. I was told by pharmacists it's just not sold in New Zealand anymore, and then I found it. So who knows what the real picture is. For women that suffer from menstrual cramps, Midol is not here. So Midol is a super common brand. It's one of the only some women swear by. Midol is the only thing that works. It's a cocktail of acetaminophen, which is Panadol. I forget what the drug name is called here, but it's the same drug. So it's caffeine and an antihistamine, and that cocktail of three things just really seems to work. So we just made our own. We got the Panadol. We got some
real Kiwi now.
DIY.
Kiwi, that.
I mean, I do have a pharmacist for a wife, so it's
true. You're right.
But so we just got the individual components and made it ourselves. We had a no-dose caffeine tablet and 1,000 mils of Panadol and a little antihistamine tablet, 6-hour antihistamine tablet, and it worked. So
just switch it down with a cup of coffee or a good You know what will happen now, though, because this always happens when you move to another country and you've made this lovely little concoction of this drug that works. is you will always want it to be that way now. So when you go back to the US, you're going to be like, I don't want that. I've got my own little, my Kiwi little thing, you know, it's just, that's always the way, isn't it? Oh, I love it.
Let's see. I'm trying to think, are there any other stories here that
Yeah, well, I was just going to say, the one thing I just want to ask you, which is, like I said to you before, you know, well, two things actually. First of all, just answer me this, because I don't think I didn't ask you properly, but I always think, and I know this is what you're going to laugh when you hear this, but I always think when I lived in the UK, Madonna, right, got pregnant, and she said in the papers, you know, because obviously everything in the papers is true. She said in the papers, there's no way I'm having my baby in England. I am going to the US. No, nothing exceeds the US healthcare system. Now, that's what I meant when I said to you, you've been in both now. And some people, and I don't mean to be like rude or anything, but they imagine New Zealand to be the doctors to be set up in the cowshed, you know, with the doctor walking in their gumboots and like, you know, go, here, take a swill of that if you don't feel too. I'm sure that I pick up on those vibes sometimes. I'm like, you know, we are actually, you know, quite advanced here in New Zealand. So just speak to me about that for a minute, just for those people.
Okay, so here in Taranaki, the hospital is under some major construction. They're building a whole gigantic new wing of the hospital because the existing part of the hospital is getting pretty decrepit. I mean, it's probably from the 1950s. The maternity ward is in kind of a really sort of war-torn.
Say it's a cowshed.
No, it's not. It's not a cowshed, but it certainly isn't. You know, there's you know, chipped paint and, you know, ceiling tiles that look like they're falling out. It is a bit shabby. You know, shabby. It is a bit shabby. I mean, like I said, they're in the process of building essentially an entirely new hospital. So there's going to be, you know, this isn't permanent. But, you know, people still are and have been, you know, going to the hospital under these circumstances for a while now. So it's greatly needed. You know, my wife, when she had our baby, we had our own private room, in a room that was kind of set up a little bit to look like a little hotel room. There was an effort on making the mother comfortable. I mean, that is a big difference. I will also say, now that I know how the health system here works, we had a whole bunch of tests done. Genetic tests, and you know, to ensure the health of our little girl while she was still inside Eva's belly. And I'm not sure how much of that we'd be able to do here, or how much of those genetic screenings and things would be available. And that does cause us a bit of concern. You know, I mean, we're both older parents too. I don't think we're thinking about having another child, but it is a bit of a concern. You know, we had a scare with our little girl. There was a radiologist did a scan, an ultrasound, and diagnosed a potential defect, which was just due to the bad scan and his reading of the bad scan. We ended up having an amniocentesis that confirmed that she was healthy, and it wasn't an issue. But you know, that puts a lot of fear in a parent of a newborn. And again, because we're older, we don't know. Anyway, I'm going on a lot here, but I don't know how much of those resources would be available to us here. Certainly, I don't know how much would be funded publicly, because you can't really, there's a certain limit to what you can do. And there's a certain limit to what is considered medically reasonable. And again, it's because we're in a public system, and a public system has limited resources, and we need to put the resources where they're most vital and can be most efficiently used. So that's not giving, you know, concerned parents that probably have a healthy child all the resources that someone who is at risk might need. In the US, everything is profit driven. So sure, have another procedure. Your insurance is going to cover it. Let's do it.
Exactly.
There's a financial incentive there to do as much as possible, and you know, which can work for the parents. too, in this particular case, because it put our minds at ease. But yeah, so I do have to say we would be a bit concerned about that. Again, it's also due to our age. We're both over 40, in my case, significantly over 40. So
you look really young. I couldn't believe it when you told me you look about 35. What's your secret? All it's all that coffee you keep drinking, swilling down those drugs with that coffee, isn't it? Those period cramp drugs that you keep taking.
Yeah, that's a healthy living with diabetes and coming to New Zealand. What else can I say?
No, you look great. You look great.
That's very kind.
Oh, Adam, can I just
as do you, Liz.
Can I just ask you, because I know that, like I say, we're pushed for time. Do you feel, you've moved from the US over to New Zealand, and you of all people had things to worry about because you are, you're dependent on your drugs. Do you feel, now you've been living in New Zealand for a year, do you feel safe? Do you feel looked after? Do you feel basically?
Well, okay. So now, there were hurdles certainly to get established, but now that I'm established, everything just works really well. Particularly with my diabetes. I never have to, again, I go to the pharmacy every 90 days, get all my meds, my insulin pump supplies. It's all, it's no big deal. It's all set up and established, and we're good. There was that unknowable part at the beginning where you don't know how long it's going to take to get established or what the process is. And that's what I was hoping to help with our conversation. Put people who have these, chronic diseases at a bit of ease so they understand the process and how it works. Because, whether you have diabetes or some other chronic condition, the pattern is going to be the same. You have to establish with a GP. The GP is going to refer you out. You're going to go to the hospital service. All that stuff is going to be the same no matter what. And you're going to pay the GP, but you're probably not going to pay for anything else. So most people can be put at ease. You can look up the New Zealand formulary, I believe, online. So if anybody has any questions about whether or not their drugs are available here, I highly encourage people to look them up themselves, or call your friendly Kiwi pharmacy. Just call and talk to a pharmacist and say, look, this is my situation. I'm coming from this country and I just want to know, I have this disease and I just want to know if these drugs are available. And they'll more than likely be very happy to answer those questions for you. Or again, call the diabetes service or whatever the relevant clinic at the hospital is and talk with somebody there. I found that Kiwis are very, very eager to help.
That's really good advice. That's really good advice. So before I let you go, is there anything that I haven't asked you, or you want to just add, that you think you've been so helpful, by the way, Adam. This has been such an incredibly helpful conversation. It really is.
I don't know. Did you want to touch on dental? We could kind of speed through that.
Yeah, just as long, because it's 20 to 1. So I just don't know how you are for time, because I know
I'm good. I'm good.
You're okay.
So basically, so the thing with dental, so we talked about earlier. So medical for children is free, 13 and under. And by the way, at 14, it costs, I think at our clinic, I think it's like $15 to see a doctor. So it kind of ramps up based on age, how much you pay for your GP visits. It's still not terribly expensive. For the dentist, so dental is very different. It kind of carries over the idea of having a public health system and not having the resources to service everybody as much as I think would be ideal. Or maybe it's just that I've grown up in a culture where, you get your 2 dental cleanings a year and you're supposed to do that for your whole life, again, because it's profit driven. So you want to have clean and healthy teeth, but also, people get paid. People get paid. There's a financial incentive to drive that. Here, there's limited resources for dental. So children are fully covered at one visit per year. In Taranaki, I'm not sure how it works elsewhere, but there's these little community dental clinics. You do have to call to enroll your child in, what is it called? There's a service called it's called Happy Teeth or something along those lines. You can if you do have young children that are coming to New Zealand, you can call the Plunkett line. Plunkett is it's a nurse service that a free call to a nurse is part of the healthcare system. They'll help you with any kids 5 and under. They'll answer all your questions and be able to refer you out wherever you need to go. That's how I found out about this. But basically, there's these community oral health clinics all over that they'll schedule in for an appointment once a year. Ordinarily, they'll just send you a postcard in the mail, like, and say, show up at this time. But generally, if you have a problem or something, May had the tooth pain. She had a sinus infection, and I think it was manifesting as tooth pain. So she didn't have any tooth decay or anything, but we didn't know that. So we took her to the the community clinic. She was seen on the same day. I don't know how common that is. I think we might have gotten lucky, but she was seen on the same day. They checked her out and gave her a clean bill of health, and that was it. Okay, we're good for another year. I'm not sure that I felt comfortable with that because she didn't have she was just had an exam. She didn't have a cleaning. So we did find a pediatric dentist that who does family dental work too. So we figured we'll just go as a family, get her teeth cleaned, and maybe can get her cleaning too. They're not common though. Pediatric dentists are not common because most pediatric dentistry is done for free, either at schools or at the community clinics. And so there's not a big market for it. Kiwis don't prioritize dental the same way, I think, as we do in America. But we want to be sure that our little girl has healthy teeth. And we went down, and one of the first things that the dentist told us was that it's so good to see a child with healthy teeth, because she's a private dentist, but she gets referrals from the public system mostly. So she's working on children that have real problems.
Right.
She's not, because if you're referred from the community clinic, it's going to be a free visit. It's going to be a funded visit. I don't think there's very many people that just go in as self-pay patients to dentists here. They tend to go if there's a problem, or if there's, you've got a painful tooth. So, whereas in the US, we get cleanings generally twice a year if you have dental insurance cover, and that's free. It was pretty pricey. I think we paid for a full dental cleaning and x-rays per adult. I think it was about $260 New Zealand. So, and May's exam, including x-rays, was, I think, $130.
Right.
So, it was pricey.
So how much was it? $260 for a clean and to be seen?
And x-rays. Yeah.
I don't think that's that bad. I don't think that's that bad, actually, Adam. Yeah.
Yeah. I mean,
more than that.
In the US, you would pay dental insurance premiums. It would be deducted from your paycheck, and you're probably going to end up paying $500 or $600 a year for a family for dental insurance anyway. So whether you pay for it out of insurance or you pay it directly to the dentist, this is, again, one of those things where I feel like it's kind of a wash. Because even if you have dental insurance in the US, if you need additional work, fillings or crowns, you pay for that. The insurance pays very little. So it's really kind of, I don't think that there's the savings that people in America might think there is. Once you take the insurance premiums into account. So, and the next time we're seen, we won't need x-rays, and the cost will be about $150 per adult, right. I think, for a cleaning and a polish.
Yeah.
But if we want to keep, and the dentist did tell us, my mouth is healthy. She said, I can see you every year. As opposed to, every 6 months.
Does that feel weird for you though? When you've been...
It does.
Yeah.
Yeah, it does.
Americans have all got nice teeth, haven't they? I always notice that about Americans. They've always got nice teeth.
That's why.
Yeah.
Because we're,
But if you didn't have the money, you wouldn't be able to afford it, would you? If you didn't have a job that was paying for it, then, Yeah.
No, there's probably a lot of people in that situation that just deal with it.
I know growing up in the UK, we were only seen, I think that was, again, a school dentist used to come round and sit you in the chair and just like, talk to you once a year. And so when we came here, like both my kids have only ever been seen, like you say, they go along to that, or they used to go along to that little community and little health thing there, the dentist there, and they were always really lovely. But yeah, they only got seen once a year, I must admit. But I was, touch wood, they were lucky enough not to have any tooth problems. But
yeah,
goodness knows how, the amount of ice creams and stuff they
I know, believe me, I know.
That's the other thing
with a sweet tooth.
Yeah,
but I think we'll feel comfortable with her going to the community dental clinic for one visit, and then 6 months later we can take her to the dentist. And then we're only paying for it once a year, and we're still getting in those six monthly visits. And she's probably right. I have a history of good teeth. I can probably get away with going once a year. Eva, on the other hand, has generally needed more dental care than I have through our life. So we'll have to figure out. We did look into private health cover for dental. Wasn't really recommended though, because it's expensive, and the insurance broker told us it generally tends to be a wash with the premium you pay versus for the insurance policy versus what you would pay to the dentist.
Right. So it's not worth it then. Not worth it.
It's generally not worth getting dental cover here because it's expensive. It tends to, you tend to pay the same for it. I suppose if you had a situation where you needed lots and lots of dental work and it wasn't, a pre-existing condition when you bought the policy, it might pay out. But otherwise, in general, they said it's not really a good, worthwhile to get.
Well, Adam, this has just been so informative. You've just been super, super helpful. And I'm sure anyone listening to this is just like, oh, thank goodness. Thank you. Because as you said, when you're coming over, all these little questions that you want to ask, and just, as much as you can find out a glut of information, you just want someone who's done it. You just want someone who's been in it. And that person, my friend, is you.
Well, if anybody, if anyone has questions, they can reach out to me on the private Slack group. I'm happy to help, especially fellow diabetics. Someone reached out to me recently. I'm really happy to help people with navigate that sometimes convoluted and scary pathway.
Yeah, and I just want to say that as well. You, like I say, you're a member of our private community, and you're so great. Honestly, you're brilliant. I always look on your chats and everything, and everyone's just like asking these questions, and you always give these big, long, in-depth answers. And it's just, you don't know how helpful that is. It's really, really reassuring and helpful. So I just want to say thank you. Thank you so much.
Sure.
Yeah.
It's my pleasure.
And thank you for chatting with me today.
Of course. Always lovely, Liz.
Okay, Adam. I'll speak to you soon.
Okay, bye.
Okay, bye.
Imagine this. You're a young family who live in the UK and you want to move to New Zealand. But there's just one problem. You've never, ever been to the country. And there's another problem. It's thousands and thousands of miles away at the other end of the earth. So what do you do?
I'm not kind of completely blinkered about New Zealand. And like I say, I don't expect it to be utopia and to be perfect, because nowhere is. Every single place has got its problems and its issues.
In this week's show, you're going to meet Nikki. Nikki moved to New Zealand from England with her family, having never been to this country before in her life. Let's jump on in and find out if New Zealand turned out to be the utopia that she thought it would be.